I would say there's a lot of different things that are playing into it, no one individual aspect. The virus itself tends to be in the coronavirus family. Of course, this is a new novel coronavirus, tends to be seasonal. So we expected as the colder weather came, the virus would pick up. But we also have the aspects that are people are moving indoors, closer together. And then once you start having a lot of disease in the community, it rolls upon itself like a snowball. And so you get disease amongst disease, and that can cause the outbreaks to get expansive and be very challenging to slow down. So I think those are some of the points. I'm probably missing a few points that Jim would want to add in.
I guess the only thing I would add in is that this uptick really started happening, late July, and it's just been kind of riding that curve since then. I think with school going back into session, that definitely impacted things as well. A lot of linkages with universities, a lot of linkages with elementary and high schools. But as Greg said, this kind of becomes a cumulative effect. If you start to get some cases rolling in, like late July after the holiday, and there's good investigation work done, you're going to identify more cases. Each one of those cases can lead to other cases, as long as you're doing the contact tracing and the testing that is something that we were doing in pretty good numbers, back in July and August. A lot of that has just kind of rolled into the season now, where we worry about, as Greg said, respiratory season is typically when we move back indoors, we close the windows, there's less ventilation. The virus has actually survived better in these temperatures that we're dealing with now as well. So a lot of factors, and that's why we were concerned and talking about the impact of this during the fall for some time.
Now, the restrictions that took effect last Friday, do you think they're adequate? Is there anything else that should be done?
I think there's the aspect of what we can get done and what the population's going to follow and do. I would have liked to seen a better compliance universally, even before this came in, as far as how mask wearing was being done, aspects like that. This is really a population-based disease because it's a respiratory disease and easily transferable. And thus we need people to be all working together, and you can't have a large proportion deciding not to follow the guidance and expect the virus to go away. I think the new guidance that has been put in is helping to address those issues, but the bottom line is it's really not as much about just guidance, but what the community will actually implement. We can write all the guidance we want, but if it's not actually being done with a good proportion of the population, the virus creeps along.
As Greg indicated, I think we've had our challenges in Montana with enforcement issues, and we've had challenges with masking issues. If you look at the estimates of masking use in Montana, we're well below where you would want to be in order to help contain the spread of this. The University of Washington's Institute of Health Metrics and Evaluation estimates Montana's mask use just now during the peak of this is hitting about 62%. If you look at some of the other areas where they were doing a little bit better as far as control, Vermont, New York, states like that, they were up above the 75% mark, sometimes above the 80% mark for mask use when things were going badly. Enforcement challenges and compliance has led to spread in some communities, which is hard to protect other communities even when they're complying with these issues, when there's so much kind of pushing at them with respect to disease.
And just to add to what Jim just mentioned, I think that 60% number is surprising. It's even more surprising when you start to look at that. That's not across the board of Montana. We could find certain areas that the compliance is a lot lower and other places that are higher, just like what we talk about with immunizations. And that puts more people at risk. But 60%, even if it was equal across the state, is too low.
Now we've been averaging, I don't know, seemed like over 1,000 cases a day for some time, new cases. Is it realistic to say, okay, we can bend this down in the next few weeks if we do X, Y, Z. Is that even a possibility?
I think the issue here is not to look at it in just that silo. I think with the idea that this vaccine is coming and coming very soon, and it looks like it's going to be an effective and safe vaccine, although we'll wait for the FDA and ACIP, the Advisory Committee on Immunization Practices, to give their viewpoints and be able to look at the data itself. But I think what we're talking about is there is a little bit of a light at the end of the tunnel. And I think starting to really follow the interventions and leading ourselves into a point where we can start to get people vaccinated and decrease the risk within our communities, I do think there is hope and ways to go forward. So it's not just the following the public health guidances, isolation, quarantine, hand washing, 6 feet distancing, and all the other things that we've talked about. It's also that in the picture. But if we sat here and waited until everybody got vaccinated, we're going to lose a lot more lives and have a lot more people suffering. So we want to move now, doing all the public health interventions, and be able to get the vaccine out and ready and going as soon as we know it's safe and effective.
And so are you saying that unless people change their behavior, we're going to continue to have this many cases, new cases, until a vaccine comes onto the scene?
I think there's a strong possibility that unless people put in safety measures, that we can see numbers like this. We could even see numbers higher. When you look at the numbers that we have, and we suspect that this is very much an undercount, but we just went over 50,000, and I'm probably behind a little bit, so Jim can correct me on exactly the number we're at. Assume that that's 5% of Montana's population. A lot of people are still very vulnerable to this virus and are susceptible to acquire it and pass it along. Now, we suspect that that number is an underestimate because there's other people that are out there that never got tested or might have had mild symptoms or no symptoms at all and didn't come forward. But we still aren't anywhere near, a situation where you'd think you'd have 60 or 70% of the community infected, which would then lead us towards what they keep talking about as a possible herd immunity status. And we don't even know what that number would need to be to actually start to have herd immunity and seeing decreases that way. So nobody can predict the future 100%, but I think the science and the data in front of us would give a lot more reasons to say we need to get on board and need to do this as a community together to decrease the number of future cases. We can't just wait for everybody to get the virus.
And I think just to kind of echo what Greg said, and back to your question, I think we don't expect to see changes, overnight because of these, restrictions that have been implemented. But I do think it should slow things if there's compliance with these, new measures. We're entering a time of year where we expect things to get dramatically worse because, again, everybody's coming indoors. We've got holidays. We're going to have people mixing that, haven't mixed before. We saw upticks after July 4th with the summer holiday. You combine that with, what goes on around Thanksgiving holiday and people being indoors in close quarters. We're setting ourselves up for, kind of a bad time, which is why CDC and others have recommended that people keep their distance at Thanksgiving here. Again, we're trying to bridge a little bit longer for a few months until an effective and safe vaccine is available. It will help be another tool in the toolbox to kind of control this. But it's not going to turn around super quickly. I mean, with a 2-week incubation period and with people kind of fatigued about taking the measures, it's hard to kind of make that impact on the population. But these measures, hopefully will slow it down a little bit and buy us some time until the vaccine arrives.
And to add to that, I just want to add one other point that I think is really important. We need to slow this down to be able to that the hospitals can keep up. They're teetering on capacity in so many areas around our state, and we can't have the numbers continue to rise and expect that they're going to be able to meet all the demand. So slowing this down, spreading this out is very important, that we have the treatment side as effective and available as possible.
Yeah, that was one of my next questions. Is that we have 1,000 cases a new day. How long can that continue and our healthcare system not be overwhelmed? I would think they would, since it gets brought up.
I would say that they already are overwhelmed. They are working together, and I have a lot of kudos to give to our hospitals and medical staff that are working around here, because they are really partnering across lines, competing hospitals and everything else, working to share resources and even the load so that everybody can give them the best care possible. But we can run into problems if it gets even higher. And to add on to it, we get healthcare workers that get sick, so then they have staffing issues. We also have issues with just burnout. I think the hospitals get a lot of understanding in the numbers there, but just go to any of the ERs and see how many people are coming in that they're having to constantly see, that they're not sick enough to actually end up in the hospital, but the ER providers are seeing these patients, trying to take care of them, get them in the right sense, and give them the guidance of what to do and to come back if things get worse. The capacity there is getting pretty busy.
Earlier we talked about, you talked about we could pass whatever regulation we wanted to, but maybe not everybody would comply. I'm wondering if you could, snap your fingers and say, okay, Montanans, here are the number 1, number 2, and number 3 things you have to do to stop this or stop the spread or retard this spread. What would those things be?
Well, I mean, the bottom line is it's a virus that needs another human body to live. I mean, yes, it can live for a little while outside of the human body. How long, we don't specifically know, but it makes a difference on environment and everything else. The biggest way that this is spread is from droplets from one person to the next. And so what you want to do is be away from other folks. You want to have your own bubble that you know people are safe in. You want to limit the possibility of interacting. So first thing to do is to stay home, stay as isolated as you possibly can with your own bubble. That would be the first thing. If you need to go out and things, make sure that you're social distancing as much as possible, 6 feet at least. And if there's any possibility, even at 6 feet, I would put on the mask, but definitely if you're going to be any closer, that you have a mask on to decrease the risk of those droplets getting out of your mouth and possibly infecting somebody else. And now we have even some evidence that it helps prevent the wearer. So those are the aspects that I think are very common and need to be done for the generation of for everybody. If you are sick, get tested and make sure you stay home. If you are known to be a close contact, quarantine yourself so you don't expose other people, because we do know this virus can be spread when people are asymptomatic. But if you really just keep that simple context down, that the virus needs to jump from one person to the other, and you can limit the ability of that person, you coming in contact with anybody else, thinking about the concept that you may have the virus at all times, that will help bring down this disease.
Now, in the beginning of this, earlier this year, I mean, I read and you talked about as well, saying that able to kind of reduce the spread or stop the spread, and we need to be able to test people, contact trace, and isolate those with the virus. Are we beyond that now? I mean, I'm assuming we're still doing that, but is that even really an effective thing we can do now to stop or slow the spread when it's become as prevalent as it is?
Jim, do you want to start on this one?
Sure. Yes, I mean, that still is an effective way to minimize the spread of the virus. There are several jurisdictions that have limited resources, as you can imagine, and some of those jurisdictions have had to prioritize this effort. You can prioritize that effort and try to address it in the areas where there's highest risk. You can, make sure that the highest risk contacts get the focus, get the attention with testing if your resources are limited. You might tell a college-age student that they're close contact, please lay low, quarantine, but not necessarily test them, but you might test their mother or their grandmother if that person is more susceptible. So these are decisions that some of the larger health departments are having to make as they prioritize the resources available to them. But it is still an effective way to do things, and most of our jurisdictions are still able to apply those measures to their outbreak.
Okay.
You are correct with the idea, though. When the numbers get really hard, it gets high, it gets harder. There's no doubt about it, and that's why this prioritization does happen. And I think one way that you can see that it has worked still well in certain areas, and Jim can correct me or add on to what he wants to, but in a lot of the school situations, we definitely have had cases in schools, but I think in a lot of the places, the schools have responded very well, using contact tracing and isolation and quarantine within those situations to prevent small outbreaks from becoming really large outbreaks.
Yeah, I think that's a real good example, Greg, because I think some of the schools that had a limited number of cases got on it quickly, and they were able to kind of keep it at bay and continue education. So, if it's intervened early and you've got some tools and kids staying home from school, you can kind of control that part pretty well. That made school a safer place, helped limit the spread, and schools were able to open back up. On our listing of schools, there's a lot of them that had cases that have not had cases in the last 14 days, showing that you can control this.
I have one last question, kind of two questions really. And the first part of the question is, what do you say to those people who say, this isn't that big of a deal. This is just a severe case of the flu. That's my first part of the question. And my second part of the question is, as far as a vaccine, how soon do you think we're going to see a vaccine available, and how widespread will it be available?
So to go to your second question first, we are getting different information as far as a specific day, and I think it's really hard to tell without having a final approval or an EUA, Emergency Use Authority, from the FDA. They will give us that, and then the ACIP, the Advisory Committee on Immunization Practices, will give us information, and we'll move quickly from there. I think we can, it surely looks like it will be sometime in December that we might get our first doses. We've also kind of gotten different numbers of what that first round might be. We do have our guidance out of who we would try to vaccinate first, but that will also depend on not who we will, but how far we can get in each of these categories, pending on the arrival and how much we get in the first allocation. It also looks like there's two different vaccines. One that people have been talking about the most is Pfizer, and that most likely will be the first one that will come out unless there's something that happens through the FDA evaluation of these. And then Moderna would be soon afterwards. So all that will play into this. And I forgot your first question, Mike, so I apologize.
Well, the first question was, what do you say to people who say that this is not big of a deal? This is just a more severe, maybe a little more severe case of the flu.
I'm not sure I'm going to convince anybody anymore. We've had this conversation for the longest time. Sadly, I think you can look at the numbers and the concerns that are out there. I know we're over 250,000 deaths, and it's probably more in the United States overall, secondary to this virus. I know it's more. And it's had a devastating effect on a lot of folks. The good news is many people have mild symptoms and recover. We're starting to learn about, is there post-COVID symptoms that some folks may have, and who are likely to have them and who won't. There's people that have been in the hospital for a long time and were able to survive, but have a lot of time away and effects from all of that. So, first of all, I'd probably say it's not just the flu, because we know the flu kills a lot of people every year, and that's why we highly encourage people to get vaccinated. And also we tell people to stay home when they're sick with the flu season. But this seems to have a higher case fatality rate than the flu. And the numbers, because of everybody, so many people being non-immune to this because we haven't seen this virus before, and not having a vaccine available, puts many more people at risk, puts more pressure on the healthcare system, which can have ancillary effects on that too, when they're being overrun with many of COVID cases, needing to continue to take care of so many other issues that are going on in our communities all the time. Jim probably has some things to add.
I guess I would just add that, I mean, having looked at communicable diseases for a long time here, we haven't seen, anything close to this with respect to a communicable disease where in a matter of 8 months, we have, almost 650 Montanans dead because of a communicable infection. To not only focus on the deaths, which seems to be where a lot of people go, we have about 2,500 hospitalizations. That's a lot of resources. That's a lot of cost. That's a lot of impact on the medical system. And the signs right now are that impact could get worse, which is going to impact other people that don't even have COVID that need to access the medical system. So, the impacts of this go beyond what people think about when they just talk about a case fatality, rate or a small percentage. But even that, if you look at 1% of the population, if we say that, 1%, that's still 10,000 people in Montana. If everybody in Montana, was a victim of COVID or got COVID, and 1% was our fatality rate, that's 10,000 Montanans that you would lose during that time. That's a sobering number for some folks.
Yeah.